Breast size is important to many women. An increase in the fullness and projection of the breasts can lead to a more balanced figure, more confidence, and a better self-image. This presentation is an overview of breast augmentation. It is not a substitute for a complete consultation with a surgeon. Breast augmentation is plastic surgery that increases breast size and enhances the shape of the breast through surgical placement of breast implants. This type of surgery is used to increase the size of smaller breasts, to restore breast volume that has diminished following pregnancy or weight loss, and can also be used to achieve symmetry in moderately disproportionate breasts. Breast augmentation will not correct sagging breasts. However, the procedure can be performed in conjunction with a breast lift to further improve the position and shape of the breasts. There is no medical treatment of any kind that produces the same results as augmentation. Adult women of any age are good candidates for breast augmentation. However, it is recommended that a woman's breasts be fully developed prior to the procedure. Candidates should be healthy with no life-threatening illnesses or medical conditions that could impair healing. During a full consultation, you will be asked about your expectations for breast augmentation. You will also be asked about your health history, including any history of breast cancer in your family. You should be candid about any medications you are currently taking, the use of any vitamins or herbal supplements, and any alcohol, tobacco, or drug use. Full disclosure is important to your safety. Prior to your procedure, you will be asked to sign informed consent documents. These assure your surgeon that you fully understand the procedure you are about to undergo, including any risks or potential complications. You must also commit to precisely following all instructions you are given. Instructions include pre-surgical considerations, such as testing and medications, day of surgery instructions and medications, and specific information relating to the use of anesthesia. Local anesthesia with sedation or general anesthesia is required. A mammogram may be recommended prior to the procedure to check for breast health and to serve as a baseline for future comparisons. Breast augmentation is generally performed on an outpatient basis. The procedure can be performed in an office-based surgical facility, an ambulatory surgical center, or a hospital setting. Each breast augmentation procedure presents a unique set of considerations that the doctor and patient will work together to optimize. These choices include the type, placement, and size of the implant, as well as the incision pattern. The implant is surgically placed into the body through a small incision located in one of 3 places. An inframammary incision is made near the breast crease. A perioreolar incision is made at the edge of the pigmented skin surrounding the nipple. An axillary incision is made in the armpit. The desired incision pattern depends on the type of implant, the desired degree of enlargement, the patient's individual anatomy, and the combined patient-surgeon preference. Once an incision is made, a pocket is created in one of 2 places. For submammary placement, the pocket is located directly behind the breast tissue. Submuscular placement creates the pocket beneath the pectoral muscle, on top of the chest wall. The implant is inserted and positioned in this pocket. Breast implants are medical-grade, biocompatible devices approved by the United States Food and Drug Administration for safety. They are made of a smooth or textured silicone shell and filled with a sterile saline solution. In the case of a rupture or leak, the body will safely absorb the solution. Careful review of scientific research by independent groups, such as the National Academy of Sciences Institutes of Medicine, have found no proven link between breast implants and autoimmune or other systemic diseases in women. Implants may be pre-filled prior to placement or slowly filled at the time of surgery by means of a self-sealing valve. Occasionally, companies introduce new types of implants, so there may be additional options. Once the implant is set, the incisions are closed with layered absorbable sutures in the breast tissue. Sutures, skin adhesives, or surgical tape are used to close the incision on the skin's surface. Immediately following your surgery, dressings or bandages may be applied to your incisions. An elastic bandage or support bra will help minimize swelling. Before being released, you and an accompanying family member, friend, or caregiver will be given specific instructions detailing your post-surgical care. These include how to care for the breasts after surgery and which medications to apply or take orally to aid healing and help reduce the risk of infection. They will also detail what changes to look for at the surgical site and when to follow up with your surgeon. Each implant has a manufacturer, a style, and a specific serial number. As part of your manufacturer's warranty, you will be given this information for your records. Your recovery from plastic surgery of the breast may include swelling and discomfort at the incision sites, as well as in the breast tissue overall. Discomfort is common and may be controlled with medication. You should begin light walking as soon as possible following your surgery, and a support bra may be recommended for a week or two. Initial wound healing may take 1 to 2 weeks, followed by the removal of any necessary sutures. Possible complications include bleeding, poor healing at the incision site, thick, discolored, or raised scars, changes in nipple sensation, and infection. In some cases, visible wrinkling of the skin may occur over the implant. The most common complication with breast implants is known as capsular contracture. This is a condition where the naturally forming scar tissue around the implant begins to contract, compressing the implant and making the breast feel firmer than normal. This condition can be addressed and may require revisional surgery. Correction, however, may not be permanent. Breast implants are not guaranteed to be lifetime devices. They may leak or rupture, and future surgery will likely be required to replace one or both implants. Women who smoke are at increased risk of poor healing. They are advised to stop smoking for several weeks before and after their surgery. In general, breast augmentation with breast implants does not interfere with a woman's ability to breastfeed. The results of breast augmentation surgery are visible immediately. You should be able to return to work or normal activity within a week. However, don't engage in any heavy lifting or vigorous exercise until you are cleared to do so by your surgeon. Breast augmentation is a highly satisfying plastic surgery procedure that enhances the size and shape of a woman's breasts. While the results are usually permanent, your breasts may change due to aging, weight fluctuation, hormonal factors, and gravity. Your new enhanced breast size and body contour will give you better self-image and the freedom to wear certain clothing styles without the need for padded bras. Your new shape will give you the confidence you're looking for.